The public health silent crisis. Who is protecting mothers in South Sudan? The question that shook the internet. What if I told you that in some places, giving birth has become one of the most dangerous moments in a woman's life? Not because childbirth is naturally unsafe, not because mothers are weak, but because systems fail them. Recently, I released a video asking one simple question. What is happening to our mothers in South Sudan? Within hours, the video spread across TikTok and Facebook. Thousands of people watched, hundreds commented, survivors spoke, families who lost loved ones spoke, young women spoke with fear in their voices. And what emerged was something deeply disturbing, stories of mothers pushed into C-sections they never expected. Stories of families pressured to pay money before surgery, stories of women who survived by luck, and stories of women who never made it home. This is not gossip anymore, this is a public outcry. Today we must talk about maternal health in South Sudan. We must educate ourselves, we must challenge the system, and we must protect the future of our mothers and daughters. Voices from the ground. What people are saying. The most powerful part of the viral video was not my voice, it was the voices of the people. One health educator commented, I think preeclampsia and eclampsia in South Sudan are caused by environmental factors and psychosocial stress. Many families are facing economic crisis. This raises an important point. Maternal health is not only medical, it is social. It is economic, it is environmental. Stress, poverty, food insecurity, and lack of antenatal care can increase risks during pregnancy. Another woman shared a shocking story. My sister's first baby was supposed to be a C-section, but the second baby came out quickly after she entered the operation room. The doctor was upset with the baby. All the money was returned. Think about that for a moment. If the baby came out naturally, why was surgery recommended in the first place? Another viewer wrote, C-section and then dying. They need to fix the medical system. A survivor of preeclampsia shared her experience. I survived preeclampsia last year by the grace of God. My blood pressure was over 178. That number is extremely high. And severe blood pressure like that can be life-threatening. Another woman said, my first C-section was in Uganda due to high blood pressure at 32 weeks. My second pregnancy in Juba. I go for antenatal visits every month, and now I'm confused about what to believe anymore. Confusion is dangerous. When patients lose trust in healthcare, the entire system collapses. Another mother said, I didn't want a C-section, but the doctor told me if I don't do it, my child will die. I had to accept. Fear, pressure, urgent decisions. But were these real emergencies, or were some of them unnecessary? One comment captured the anger of many citizens. We lost many mothers and the government doesn't seem bothered. We don't have professional nurses and doctors. Another person wrote, C-section happens and complications happen during delivery, but in South Sudan it is done to get more income in hospitals. If this is true in even a small number of cases, it is extremely serious. Healthcare must never become exploitation. Another story shocked many viewers. My mom experienced labor for almost a week and later gave birth to twins normally and healthy. This reminds us that not every difficult labor requires surgery. Another heartbreaking comment said, many mothers have lost their lives because of C-sections. Another young woman expressed fear shared by many girls. This scares us. We see our friends and family die just trying to give birth. It's so risky for us. Imagine being a young woman afraid of motherhood. That is a national tragedy. One commenter added, lack of medical experts, expired drugs, and economic collapse have increased suffering for our mothers. And one of the most painful comments said simply, I lost my son because of that. Another man shared a powerful experience. His wife was told at the last week of pregnancy that she must have surgery immediately or risk losing the baby. But he questioned the diagnosis. He asked his wife to go home. That same night, she went into labor. Within minutes, she delivered normally and safely. His message was clear. Let us not be pressured by people who are after money instead of doing the right thing. And then came one final, devastating testimony. I lost my sister 3 weeks after childbirth due to complications. These are not statistics. These are human lives. Understanding maternal health, what science says now. Let us pause and talk about facts. Pregnancy is not a disease. Most women around the world give birth safely. However, complications can happen. One of the most dangerous complications is preeclampsia, a condition involving high blood pressure during pregnancy. According to global health research, severe blood pressure above 160/110 can cause strokes, seizures, organ damage, and death. When untreated, preeclampsia can progress to eclampsia, which causes seizures. This is why doctors monitor blood pressure carefully during antenatal visits. The World Health Organization recommends early detection, monitoring, and treatment. The medicine magnesium sulfate is widely recognized as the best treatment to prevent seizures in severe cases. Antihypertensive medicines are used to control blood pressure, and sometimes delivery of the baby becomes necessary. This is an important point. Delivery is the only cure for severe preeclampsia. But delivery does not automatically mean surgery. Doctors can induce labor. They can support vaginal birth if conditions allow. C-section should be used when medically necessary, not automatically. Globally, research suggests that extremely high C-section rates do not improve outcomes. Overuse can actually increase complications. The system problem. If South Sudan is seeing unusually high rates of hypertensive diagnoses and emergency deliveries, something must be investigated. Maybe stress and poverty are contributing. Maybe antenatal care is insufficient. Maybe medical equipment is inaccurate. Maybe staff training is inconsistent. Or maybe, in some places, profit incentives are influencing medical decisions. Whatever the cause, ignoring the problem will cost more lives. What responsible government must do. Maternal health is one of the most important indicators of a nation's development. Countries that protect mothers build strong societies. Countries that fail mothers weaken their future. If maternal deaths are rising or public trust is collapsing, the government must act immediately. First, national maternity protocols aligned with World Health Organization standards must be implemented across all hospitals. Second, essential medicines like magnesium sulfate and antihypertensive drugs must always be available. Third, medical staff must be trained to measure blood pressure correctly and diagnose hypertensive disorders accurately. Fourth, every maternal death must be investigated through mandatory case reviews. These reviews identify what went wrong and how to prevent future deaths. Fifth, hospitals should publicly report their cesarean section rates. Transparency protects patients. Sixth, independent audits should examine whether surgeries are medically justified. If coercion, false diagnosis, or profit-driven surgery is occurring, it must be exposed. Seventh, strict licensing and regulation must ensure only properly trained doctors and nurses practice medicine. Clinical guidelines alone cannot save lives. Systems must enforce them, learning from other countries. Many countries once faced maternal mortality crises, but they reduced deaths dramatically through strong policies. For example, training midwives to manage normal deliveries, strengthening emergency referral systems, providing free or affordable maternity care, tracking every maternal death, improving blood banks and surgical safety. These changes saved thousands of mothers. South Sudan can do the same. A message to healthcare workers. Most doctors and nurses enter medicine to save lives. Many are working under extremely difficult conditions. Low pay. Limited equipment, overcrowded hospitals. Their work deserves respect, but medical ethics must always come first. Patients must be informed, diagnosis must be documented, decisions must be evidence-based, and exploitation must never be tolerated. A message to families. Families also have power. Ask questions. Ask for repeated blood pressure readings. Ask for written ultrasound results. Ask whether induction is possible before surgery. Ask for second opinions if time allows. Emergencies are real, but informed consent is essential. The future of motherhood in South Sudan. A society that fears childbirth is a society in crisis. When young women say they are afraid to have children because they see mothers dying, we must listen. Maternal health is not just a medical issue. It is a national survival issue. Protecting mothers protects families. Protecting families protects the nation. Final call. This conversation is not about attacking doctors. It is about protecting mothers. It is about demanding accountability. It is about building a health care system people can trust. To the government, do not allow maternal health care to become corrupted like other sectors. Do not ignore the voices of grieving families. Do not wait until this crisis grows worse. Investigate, regulate, reform. To the people, keep speaking, keep sharing your stories. Because silence protects systems that fail us, but truth protects lives. Every mother deserves safety. Every baby deserves a chance. And the future of South Sudan depends on whether we choose to protect them. The question is simple. Who will stand up for our mothers? Because protecting the womb is protecting the nation. Majok is a public health researcher and academic based in Australia.